The flu typically occurs in winter months, anywhere from November out until March, sometimes April. So that's the period in which you're most vulnerable. And so ways to prevent this is to starting with is getting a flu shot. Flu shot isn't always perfect, but generally will decrease symptoms even if you do get the flu, and you're less likely to get hospitalized if you get a flu shot. And then obviously hands, washing your hands frequently, avoiding people that are sick, staying hydrated is important. And using what we call good respiratory etiquette. So if you're coughing, don't cough in your hand, cough into your armpit or to your elbow to avoid spraying it on everybody else. The flu itself has very specific symptoms associated with it. High fevers, body aches, feeling of fatigue. Sometimes you might start getting a cough and runny nose, but typically it's more systemic. Generally it's the whole just feeling of, I've like run a marathon, but you didn't really run a marathon. Hand hygiene, again, is really, really important in terms of how this is spread, because it's spread through droplets. So when you cough and that little spittle that comes out and then lands on things, if you touch that and then touch you, then you're likely to get the flu. There are times in which it's appropriate to get what we call prophylaxis. You would actually get pills that would normally treat the flu to also prevent you from getting it. And that would be something that you would want to talk to your doctor about. Obviously, if you've got the flu, you really probably don't want to go to work. That's probably one, is stay home. Drink plenty of fluids, making sure that your inclination when you feel bad is often to stay in bed and do nothing else. So making sure that you're keeping up on your fluids. If you're having any trouble breathing, any shortness of breath, you find that you're wheezing, then you probably need to see your doctor. And it's probably a good idea to call ahead so that you're not sitting in the waiting room potentially getting other people infected.